And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello. Welcome to Boomer Life. On the program today, we're talking about the latest innovations in hearing. We're going to be speaking about the inner workings of the ear from an expert perspective. We're going to talk about testing infants and children, and we'll be offering solutions for those suffering from hearing loss. Always a pleasure to welcome our guest, Dr. Ted Venema from NextGen and Mainland Hearing Centers, back to the program. Dr. Ted is an audiologist with a huge background in the business and sometimes spent in school just across the line in Bellingham.
Yeah.
Nice to see you, Ted.
Thanks. Good to be here.
And also, I should mention, too, that Dr. Ted appears on multiple vignettes on the NextGen and Mainland Hearing websites, nextgenhearing.com and mainlandhearing.com, with all sorts of little bits about hearing aids and why people wear them and what they do for you.
I made the mistake of telling you about that.
Well, we'll remind you about those vignettes as the program goes along. But you're an audiologist, so what exactly, Dr. Ted Venema, is an audiologist?
You can think of an audiologist like an optometrist for the ear.
Okay.
Optometrists measure vision and prescribe lenses. Audiologists measure and test hearing and prescribe hearing amplification if needed.
So if we go into any one of those hearing places in the mall or wherever we see just walk in off the street, there'll be a person at the front desk working the phones, and then there'll be someone back in the back area where the testing zone is. Is that tester person likely to be an audiologist?
There's about a 50% chance the person's an audiologist.
What's the other occupation then? What would you call it if they weren't an audiologist?
A hearing instrument practitioner.
Oh, okay.
A HIP, H-I-P. One's college trained and the other one's university trained.
Okay.
Think of it again like optometrist, audiologist, optician, hearing instrument practitioner.
Oh, I see.
Okay. So one has a master's degree, and that's the audiologist, and the person with a 2-year college diploma working in the same field is called a hearing instrument practitioner. They can both, their fields intersect. The HIP and the audiologist can both test adult hearing.
Right, okay.
And they can both prescribe hearing aids.
Mm-hmm.
Where the audiologist has a slightly larger scope of practice is that an audiologist can test infants and children.
Oh, we're going to talk about that today, too. Okay.
And an audiologist can do more advanced type of testing, like looking for, they're more diagnostically oriented. They get a little bit more training in anatomy and more like sleuths, getting to the bottom of where is the problem.
Okay.
They'll do brain waves and other weird kind of tests. So a little bit, they're more advanced than a hearing instrument practitioner. But hey, the main population is adults with hearing loss.
Right.
And both are well served by
either a hearing instrument practitioner or an audiologist.
Yep.
Back to yourself. In your background, you are an audiologist, but you didn't start out wanting to become an audiologist.
No.
You started out with a very serious inclination towards speech pathology.
Yeah.
In a master's program for speech pathology, you suddenly switched horses.
Yep.
Why?
Well, actually, I used to be a child care worker at a juvenile detention home in Calgary.
Oh, okay. Okay.
And I asked my girlfriend one time, walking up Hastings in Vancouver, I gotta get a master's in something. I've got to learn how to do something that no one else knows how to do that automatically gives you a job. I want to go back to school again.
Okay.
And she's a bit of a researcher. She works in libraries, and she kind of came back to me later. She said, "What about speech-language pathology, a speech therapy?"
Okay.
Well, that's kind of neat because I'm a bit of a yacker, and I thought, why don't we? It's a bit like acting, but more in an enabling type of profession.
Definitely.
So I went to Western Washington in Bellingham, where I used to call it Hellingbam, and started in a master's degree in speech pathology. And halfway through it, I realized, nah, this isn't for me. It wasn't what I really had in mind. It was very lesson plan oriented and very, very detailed. It just wasn't for me. I thought, but all speech pathologists have to study audiology, and all audiologists have to study some speech.
Okay.
So all I did was make a lateral shift to the right. I just kind of...
So you were taking courses in audiology anyway. And they turned out to be infinitely more interesting than the speech pathology stuff.
So I just stepped over into audiology, and I didn't lose any real time.
Oh, interesting.
So I just continued then to specialize in audiology. But the many speech pathologists or speech therapists and audiologists, at the beginning, they're taking the same courses.
Okay.
And then later on, you decide, okay, which one do I want to get my master's in? Speech or hearing?
Right. And of course, they are a function of each other.
They are.
You only speak well or poorly because of your ability to hear yourself.
They're largely tied together that way, yes.
Okay.
And that's why it's so important to test infants and babies when you detect hearing loss in them. It's very important to fit with hearing amplification right away because of the acquisition of language. You're not going to learn language if you're not hearing. You know, ask Helen Keller.
Right.
Who was deaf and blind, and she had a heck of a time learning language. And she said right out, if I had 1 sense to get back so that I could have learned language easier, it would have been hearing.
Interesting stuff. I'm thinking of a movie. This came out a few years ago. It starred Richard Dreyfuss, and the movie was called Mr. Holland's Opus.
Yep, saw it.
He plays a music teacher
That's right.
in high school. And it's set in the 50s.
And his son is deaf.
That's right. He and his wife have a little boy, and the boy is profoundly deaf.
Yeah.
He does not hear.
Yeah.
And, of course, for the music teacher
that's just,
to have a deaf son in the 1950s when they really didn't know what to do with deaf children.
It was really quite hopeless. He felt awful, awful. And then they had to really undergo a lot of transitions in their family emotionally to kind of get to be one again.
Because they really didn't have any solutions, did they, in the 1950s for children who were completely deaf?
No, they could not amplify or deliver acoustics. So then what happens is these children, you know, would go into deaf culture.
Right.
They would learn sign language.
Sure, and go to the schools for the deaf. We had one in Jericho here in Vancouver.
Yeah. And the idea is once you learn a language, you learn how to learn a language. So let the kid learn sign language, and then, hey, now let's teach him or her how to speak.
Okay.
English, you know, because sign language is a total language.
Mm-hmm.
And there's different approaches. I mean, in the 50s, they used to have the old approach, kid, you sit on your hands. You can't sign. We're going to teach you how to talk. And then, of course, at recess, the kid's out signing away because it's fluent. You know, they can see it. And it's like dancing without music. That's the title of a book. It's by Barrowleaf Benderly. It's really an interesting thing. We should do a talk show on that sometime.
Oh, okay.
A thing on language and deaf culture and American Sign Language as opposed to oral speaking and hard of hearing.
Right.
Because they are two separate camps.
But we talked a little bit about your background in terms of audiology, speech pathology, which eventually gave way to an audiology program. And now you have a PhD in audiology. And you've written a book. You just mentioned a book. And that reminded me of your book, which is called Compression for Clinicians.
Yeah.
You wrote it back in the late 90s. And what does it mean? What does compression for clinicians mean?
Yeah, I wrote it in the 90s and then updated it in 2006. Compression is what hearing aids do. It's a type of technology in hearing aids whereby they amplify soft sounds by a lot and they amplify loud sounds by little or nothing at all. And you know why they need to do that? They need to do that because hearing loss is like you can't hear soft sounds. Your floor is elevated, but your ceiling of loudness tolerance, that hasn't changed. So let's say 100 decibels is painful to someone with normal hearing.
Right.
With hearing loss, that 100 decibels is also going to be painful. So
if it's painful for a normal hearing person, why wouldn't it be painful for a person who doesn't? Well, and the answer that a lot of us would have, Dr. Ted, is, well, the person doesn't hear very well, so how could it possibly be loud or annoying or anything?
Yeah, that's the mistaken perception.
That's right.
Because deafness is, most hearing loss is nerve hair cell damage. And what happens with that is your floor of hearing sensitivity. You can't hear 0 decibels, you can't hear 10, you can't hear 30, you can't hear 40. Around 50 you might be able to hear, 60, 70, 80, and by the time you're at 90 or 100 it's getting too loud.
Right, okay.
So what they call that your dynamic range, the decibel distance between your hearing sensitivity floor, the softest you can hear, versus the loudest you can tolerate.
Right.
That's generally about 100 decibels.
Okay.
Normal hearing people can hear anything from 0 up to about 100, and then it begins to hurt.
Okay.
Hearing loss usually means you can't hear until it's more decibels than 0. It might be 50.
Okay.
But yet 100 is too loud.
Sure.
So your floor to ceiling distance is smaller. And hearing aids have to address that. So they have to amplify soft sounds by a lot so they're audible.
Right.
But as the sounds get louder and louder, the hearing aid has to back off automatically. And that's why hearing aids are quite sophisticated these days.
Okay.
Compression is the technology.
That's what they do.
That's what they do.
Ah, okay. You were talking about the range from 0 to approximately 100 dB. That's a typical normal hearing, a human hearing range.
Yeah, about.
Now we're going to talk about testing infants and children. I'm quite looking forward to this because it's got to be just even quite a challenge to pull off with a squirmy little kid who doesn't want to be tested today. Thank you very much.
You can't put headphones on an infant. They'll just whip them off.
Oh, absolutely. But before we get to the little ones, let's talk about us boomers.
Yeah.
Because if 0 to 100 is a typical range, when we start getting into our late 50s and 60s and beyond, we're experiencing age-driven hearing loss.
That's right.
So where does that start? If we don't hear from 0 to 100 anymore, what usually gives away first?
Usually the treble, high-pitched sounds.
Okay.
High-pitched sounds. And you begin to develop a hearing loss, in your 60s. You know, you can't hear till it's about 30 or 40 or 50. Some people develop hearing loss quicker. Generally, hearing loss due to age is called presbycusis, hearing loss in the elderly. Presbyterian, Church of the Elders, presbycusis, hearing of the elders.
Okay, gotcha.
And it's usually a moderate degree, about a 50 decibel hearing loss for the treble, high-pitched sounds. Bass hearing's pretty good.
Right.
They just can't hear the treble. When you can't hear the treble, you've got trouble with treble. You can't hear sh, s, t. You can't hear the high pitches of speech.
And those are the noises that make the definitions of words.
Yeah, they're the consonants.
Cases.
They tell you what.
Was it singular or plural?
Yeah,
right.
Did you say mittens or kittens?
Right.
You know, they can't hear the S on the end, like you're saying.
Right.
So, and especially if a child can't hear that, he or she's not going to learn the concept of plurals.
True.
You know, because in English, dogs.
Yeah.
That's high-pitched sounds. Hard of hearing elderly people usually say young people mumble. Well, that's because they can't hear the difference between cat, sat, bat, hat, fat. I mean, all those words have ah, and ah is a relatively low-pitched sound. It's the high pitches that define what the word is.
Okay. So now, in order for any of us, regardless of age, to actually get a fix on how well we hear or not,
get a hearing test.
We need to get a hearing test. And having been through one recently myself within the last year, I can tell you that it is a most fascinating experience. I got to tell you, I've lived more than a few weeks, and I'd never had a hearing test until just a few months ago. And I actually really enjoyed the experience, Dr. Ted, because A, I'd never had one before, so you learn just by going through a new experience.
Oh, you learn a lot of information.
Well, I learned a lot about what you do for a living just by watching Dr. Herman Lee, who's your colleague over there at Mainland at Metrotown, just conduct a very professional, very polished test in my case. He was wonderful.
Yeah, most tests at NextGen and Mainland are like that. They're pretty good. They're thorough.
Well, Dr. Lee was terrific, and I just watched a really competent professional quietly go through, and it took about 45 minutes.
Yeah.
It wasn't, you're in, you're out next.
No, and the best part is the explanation thereof. I mean, once he or she's done the test on you, then comes the explanation of the results. And that's meant to be an educational session. You learn the type of hearing loss you have and the degree, and then what you should do about it, what you can do about it. Sometimes you won't have enough hearing loss to warrant, but at least you'll know what's going on and why you're having difficulty hearing in crowds, or why you're having difficulty hearing what the word is.
Right.
And if the loss is sufficient to warrant the use of hearing amplification, by all means go for it, because it's free. The first 30 days, the first 21 days, you're walking out with a pair of hearing aids for absolute free.
Right.
And you've got 90 days to make up your mind as to whether you'd want to keep them or not. So you've got nothing to lose by checking it out.
Right.
That's, I guess. And when you had your test, did you pay anything for it?
No, I didn't. The hearing test, and that's always the best part. And it confounds me because I didn't know much about all of this before I started talking to you and Mark and the NextGen Mainland gang. But then having gone to the hearing test and realizing that anyone who wants to get a hearing test can and should, and the price is always zero.
Exactly.
It is a free and quite positive experience.
Yeah, the funny thing about
there's nothing to lose here.
Nothing. No, hearing loss is invisible, and people believe what they see. So people tend to sweep hearing loss under the rug.
Sure.
And then they go on for years just going through agony, trying to pick up conversation, and finally they give up. They want to just be alone. They're tired of answering the wrong punchline to a joke, and they don't feel like being embarrassed like that, and it leads to isolation, loneliness, and it totally curbs your life.
And in many cases, Ted, that comes from and I don't use this adjective very often at all, but in this case, I think it comes from sinful, false pride.
Oh, yeah.
Because if you don't wear a hearing aid because you don't want anyone to know you're wearing a hearing aid, it's really easy to do. But it's really easy to do in the fall of 2014. It's really easy to wear a hearing aid in the fall of 2014 and not have a single soul on this planet know you've got one.
You'd never know.
People have the stigma part, I'm afraid, Dr. Ted, has a lot to do with the old school hearing aid. People feel they kind of got a hubcap attached to their ear.
This big beige thing, beige banana behind your ear.
Exactly. Everybody know, oh, there's the deaf guy.
Yeah.
That's just not the case anymore.
You could almost say, this is Boomer Life, you could almost use the old commercial, dishwashing liquid, relax, you're soaking in it.
Right.
Because you'd hardly even know someone's wearing hearing aids today. They're
true.
Almost invisible.
Well, as I was about to tell you, I sat across the desk. Ted and I are sitting about 2.5 feet across a desk from each other right now. That's about as far as I was sitting away from Dr. Lee when I had my hearing test at Mainland at Metrotown. So he goes through the whole deal and discusses my hearing. He gives me shows me right on the graph where I hear well, and it's a little to be desired here. I don't need hearing aids yet.
And you may,
but I now have a benchmark.
Exactly.
So I can go back in a year and go, okay, you can pull out my file from a year ago. Now let's do another test and see how we're doing. But you know what? I sat there, and this is my point here, and Dwayne wants us to take a break, but I got to finish this thought. As I'm sitting there, I sit across the desk from this very polished, very calm professional for 45 minutes. We have this very nice talk. We have he conducts the test and all the rest of it. And as I'm standing up to shake his hand and thank him for his time and his patience, because I asked a lot of questions, he shows me his hearing aids. I had no clue. I was sitting 2 feet away from the man for 45 minutes, and I had not a clue.
No, you wouldn't
and
know.
he had them in both ears.
So
it's not a hubcap attached to the side of your head anymore. It's the fall of 2014. It's virtually invisible.
Yeah, it's a different kettle of fish than eyeglasses. I mean, people wear glasses as big as God on their face. Ask Elton John, you know. But hearing aids, that's a sign of age.
Right,
people, shoot, when I hit 40, my arms weren't long enough to read a page. I got glasses from the dollar store. Big, hairy deal. I mean, whatever. It's just, whatever. You want to join conversation better? You want to hear better? Check it out.
Yeah, you want to reintegrate with the human race? How about a hearing test and some practical results? And we're going to talk about more hearing tests when we come back. Dr. Ted Venema from Next Gen Hearing and Mainland Hearing is with us. Next Gen, of course, those hearing centers across Vancouver Island and the interior, and Mainland, the other division of the company with its multiple hearing centers around Metro Vancouver. And when we come back, we're going to talk about specifically testing infants and children. Because if you think putting me through a hearing test might have been a bit of a chore for Dr. Lee, can you imagine putting somebody 2 years of age or less through a hearing test? This is not going to be a cooperative human being. We're back with more on Boomer Life right after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.